Here's the mask they used to use. Nothing like now.
Ever since he was a young boy in a small southwestern Minnesota town, Randy Gilbertson has been passionate about America's pastime.
I played baseball. I've always had the passion for baseball. Number 3, Harmon Killebrew. Minnesota Twins. Him and me, Hank Aaron, he's the man. He's the home run king, not Barry Bonds.
But for the past 5 years, this high school teacher has been in a slump with his health insurance. Randy has been striking out with his monthly bills, and they've jumped sky high. More than 10 years ago, Randy was thrown a curveball. He discovered he was diabetic.
Here are my drugs. Well, my health has been good. It really has been good. The cholesterol was up a little bit. That's down. The main thing was the diabetes. These things are expensive. I was going to start getting it from Canada. I mean, it just... Well, I was paying, $8.50 a month just for the premium. And, the insulin, I think those bottles like $200. So I was paying out, I don't know, probably $1,000, $1,200 a month. I was going to go without insurance. I had come to the end of the road. This is ridiculous to be paying that much money. A lot of things I couldn't afford to do. And I'm single and I make a fairly decent living and I hardly make it. Pay $1,000 a month. I pay it's more than my house payment sometimes.
But as Yogi Berra says, it ain't over until it's over. Randy decided it was time to win the diabetes game if he could and improve his score on his health insurance.
Diabetes is bad stuff. You gotta get a handle on it. The carbs and the sugar. Cut that out. Your blood sugars will be good. And they said if you get the weight down, that'll really help too.
The 61-year-old joined a local fitness club and began to explore MNsure, the Minnesota Health Insurance Exchange, to see if he could find a way to save more money.
Because, this was all kind of new to me, looking around for insurance. I want to make sure I got something that was reasonable. And I never really thought I'd get something they'd pay for the drugs, because that stuff's expensive.
Randy looked at a number of plans with Blue Cross and Blue Shield of Minnesota.
Some were more expensive with very little deductible, but I didn't want to go back, same thing, $8,000, $9,000 a month, or you could pay $100 a month with $20,000 deductible.
He found a health plan he liked called Blueprint, then called an agent for more information.
The price was about $470 a month, but I had to pay for the drugs. And I said, you got to pay. That's one that I want to get rid of, paying for all those drugs. So she says, I think I can do something for you. So she went and scrounged around and looked, and she got something for $400, and she says, we'll pay for the drugs. That's as good as you can get, I think.
Not only that, Randy discovered his Blueprint plan would pay part of his membership fees at Lifetime Fitness with a certain number of visits per month. On January 1st, Randy switched his insurance to Blueprint by Blue Cross and Allina Health Network. Randy was already an Allina Health Network patient, so he didn't need to change doctors, and his regular diabetes checks at the clinic won't tax his wallet.
You save $800 a month, that's a lot of money. I mean, put gas in your car, on a vacation. I got to get another vehicle here pretty soon. Just living.
Today, Randy's blood sugar scores have vastly improved.
We will check my blood here. I will hit this. 141, all right, that's not bad.
He finally has some extra money to enjoy his favorite hobby.
I got it at Field of Dreams over in Bloomington at the Mega Mall.
And Randy says he couldn't be happier about hitting it out of the park with his health insurance.
It was a boon for me. It's one of the best things that ever happened in my life. And I would recommend Blue Cross Blue Shield to anybody.